What if I told you that your favorite Medicare perks, like choosing your own doctor or getting the care you want when you want it, could soon be on the chopping block? Stick around because in the next few minutes, I'll break down how major changes to Medicare could affect you, your loved ones, and millions of Americans. We'll untangle what's happening, why it matters, and what you can do to stay informed. Here's the deal. Medicare is a lifeline for over 65 million people in the US. It promises access to healthcare after age 65, and for many, it's the difference between seeing a trusted doctor and skipping care altogether. But now, some key benefits could be at risk, and the reason comes down to how Medicare is trying to control costs. Let's get specific. The government wants to rein in Medicare spending, which has been skyrocketing as the population ages. One big strategy? Shifting more patients into something called Accountable Care Organizations, or ACOs. These aren't insurance plans, but networks of doctors and hospitals that get bonuses for keeping costs low and patients healthy. Sounds good, right? In theory, ACOs encourage doctors to focus on prevention, avoid unnecessary tests, and work together. But here's where it gets tricky. If these organizations spend too much, they get financially penalized. That means the less they spend, the more they keep. And experts are warning this could have a direct impact on patients, especially when it comes to getting the care you want. Let's break that down. Historically, traditional Medicare has given patients a ton of freedom. You pick any doctor who takes Medicare, no referrals needed, and you can see specialists whenever you want. But the move to ACOs could mean more hoops to jump through. There could be narrower networks, so you might not be able to see your longtime doctor. More referrals might be required, and, according to some healthcare advocates, we could see an uptick in denied claims as organizations try to cut costs. This isn't just speculation. Dr. Don Berwick, a former head of Medicare, has said outright, there will be more denials of care. That's pretty stark. Imagine needing a particular test or treatment only to find out your ACO says no or wants you to try something cheaper first. It's frustrating, and it raises real questions about patient choice and quality of care. Let's zoom out for a second. Why is Medicare doing this? Well, the numbers are daunting. Medicare spending hit roughly $900 billion in 2023. With baby boomers retiring in droves, those costs are only headed up. The government is searching for ways to bend the cost curve without slashing benefits outright. And ACOs, with their promise of coordinated care and efficiency, are a big part of that experiment. But here's the rub. Every time the government tries to save money in healthcare, there are trade-offs. Back in the 1990s, we saw something similar with HMOs, health maintenance organizations. They also had narrow networks, and patients got frustrated with limited choices and denied services. The backlash was so strong that, over time, Medicare moved back to offering more flexibility. Now, with ACOs, we could be headed for deja vu. Let's look at some numbers. According to the Centers for Medicare and Medicaid Services, over 13 million Medicare beneficiaries are already in ACOs. That's about 1 in 5. If the government's plans go through, that number could rise dramatically in the next few years. The hope is that ACOs will save Medicare billions, possibly enough to keep the program solvent for decades. But at what cost to patient experience? And it's not just about freedom of choice. There's also the question of health outcomes. If doctors and hospitals are pressured to cut spending, will they skimp on necessary care? Or will they find smarter ways to keep people healthy? The evidence is mixed. Some studies show ACOs can lower costs without harming quality. Others find that denials and delays can hurt patients, especially those with complex needs. So, if you or your parents or grandparents are on Medicare, what can you do? First, stay informed if you get a notice from Medicare or your doctor about joining an ACO. Read it carefully, ask questions. How will your choice of doctors change? Will you need referrals for specialists? What happens if you disagree with a care denial? Knowing your rights is crucial. Second, speak up. If you're worried about losing access to your preferred doctor, let your representatives know. Policy changes happen when enough people make noise. And remember, these shifts don't happen overnight. There's still time to weigh in and to watch how the changes are rolled out. Finally, keep in mind that Medicare's challenge is real. Costs are rising and something has to give. The question is whether ACOs represent smart reform or if they're a step backward for patient choice. If you found this breakdown helpful, don't forget to hit like, drop a comment with your thoughts or questions, and subscribe for more updates on the financial stories that impact your life. As Medicare navigates its next chapter, one thing's clear: the balance between saving money and protecting choice is a debate that's far from over. Stay tuned, stay curious, and make sure your voice is part of the conversation.